As we know, breast MRI has assumed an increasingly important role in the diagnosis and treatment of breast cancer. We use breast MRI to screen patients that are high risk for breast cancer. For example, patients that have a strong family history or perhaps have a genetic predisposition to breast cancer. Once a woman is diagnosed with breast cancer, they quite commonly get a breast MRI after the diagnosis, because this allows their doctors to better visualize the extent of disease within the breast. It also screens the opposite breast, for which breast cancer may not be visible on mammography, but may be visible on MRI. And studies have shown that occurs in 2 to 3% of patients. There are a few specific cancers for which we've developed programs to help detect and monitor disease. One of these is prostate cancer, which is a disease that's very difficult to detect either by physical exam or laboratory methods. And we have a program that, in conjunction with Leahy Burlington, allows us to produce state-of-the-art imaging of the prostate to both detect the prostate cancer and to assess the extent of spread. Another area that we have designed a special program for is for patients with multiple myeloma. The traditional means of looking for extent of disease is to take a series of x-rays called a skeletal survey. It's been shown in numerous studies that MRI is more effective than any other method for finding deposits of multiple myeloma within the bones. In general, we use it to screen for cancer much the same way one would use CT, but in specific areas we're more sensitive than a CT scan. An example might be looking for cancer of the liver, or cancer of the pancreas, both of which we do quite a few exams. So it's a very important diagnostic test and is utilized with increasing frequency in the diagnosis and treatment of breast cancer. I'm proud to say that Leahy Outpatient Center Danvers is the first in the nation to have the ambient suite experience. The ambient suite experience is designed to make the patient as comfortable and relaxed as possible while undergoing an MRI exam. The patient's response to the ambient suite has been overwhelmingly positive. We've received numerous comments from our surveys saying that this is the best MRI experience that patients have had, and these are patients who have had many. Some of them told me that they thought they would never be able to have an MRI exam again until they came to the ambient suite. Others have told me that their fear of MRI is over.